Controlling blood sugar is a vital aspect of maintaining overall health, as glucose is the primary source of energy for the body's cells. The regulation of blood glucose levels is primarily managed by two hormones, insulin and glucagon, both produced by the pancreas. These hormones work in tandem to ensure that glucose levels in the blood remain within a narrow range, providing a stable supply of energy to the body's cells while preventing the harmful effects of excessively high or low blood sugar levels. When you eat, carbohydrates in your food are broken down into glucose, which enters the bloodstream, causing blood sugar levels to rise. In response to this increase, the pancreas releases insulin, a hormone that facilitates the uptake of glucose by cells, especially in the liver, muscles, and fat tissues. Insulin acts as a key, unlocking cells so that glucose can enter and be used for energy or stored as glycogen in the liver and muscles for later use. This process helps to lower blood glucose levels back to a normal range after a meal. Glucagon, on the other hand, serves as a counterbalance to insulin. When blood glucose levels drop too low, such as between meals or during physical activity, the pancreas releases glucagon. Glucagon signals the liver to convert stored glycogen back into glucose and release it into the bloodstream. This process, known as glycogenolysis, increases blood glucose levels, ensuring that the body has a continuous supply of energy, especially for vital organs like the brain, which relies heavily on glucose. This delicate balance between insulin and glucagon maintains blood sugar levels within a tight range, typically between 70 to 100 milligrams per deciliter when fasting. However, in individuals with diabetes, this regulatory system is impaired, leading to difficulty in controlling blood sugar levels. There are two main types of diabetes, type 1 and type 2. In type 1 diabetes, the body's immune system mistakenly attacks and destroys the insulin-producing beta cells in the pancreas. As a result, little to no insulin is produced, and without insulin, glucose cannot enter the cells to be used for energy. This causes glucose to build up in the bloodstream, leading to hyperglycemia, or high blood sugar levels. People with type 1 diabetes must rely on regular insulin injections or insulin pumps to manage their blood glucose levels and prevent complications. Type 2 diabetes, the more common form, is characterized by insulin resistance, where the body's cells become less responsive to insulin. Initially, the pancreas compensates by producing more insulin, but over time, it cannot keep up with the demand, leading to elevated blood sugar levels. In type 2 diabetes, both insulin production and the effectiveness of insulin are compromised. Managing type 2 diabetes often involves lifestyle changes, such as diet and exercise, oral medications, and sometimes insulin therapy to help regulate blood sugar levels. When blood sugar is not properly controlled, as in diabetes, it can lead to a range of serious complications. Chronic high blood sugar can damage blood vessels, leading to cardiovascular disease, kidney damage, nerve damage, neuropathy, and vision problems, retinopathy. Conversely, low blood sugar, or hypoglycemia, can occur if insulin levels are too high relative to glucose intake, leading to symptoms such as dizziness, confusion, and even loss of consciousness if not promptly treated. In summary, insulin and glucagon are essential hormones that regulate blood glucose levels by promoting the uptake and storage of glucose when levels are high and releasing stored glucose when levels are low. In diabetes, the body either cannot produce enough insulin or cannot effectively use the insulin it produces, leading to uncontrolled blood sugar levels. Proper management of diabetes is crucial to prevent the severe complications associated with chronically high or low blood sugar.